Good afternoon. My name is Dr. Joan Reed. I'm Dean for Diversity and Community Partnership at Harvard Medical School and a professor of medicine. And I want to welcome you to today's webinar, Harvard-affiliated Pediatrics Residency Programs. The mission of our Office for Diversity, Inclusion, and Community Partnership is to advance diversity, inclusion in health, biomedical behavior, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and ensure equity in health locally, nationally, and globally. Today's program is part of our Visiting Clerkship Program. For 30 years, the VCP has been a model of excellence, offering outstanding medical students, particularly those from underrepresented groups in medicine, an opportunity to participate in externships at Harvard Medical School and its affiliated hospitals. Since inception, more than 1,500 students have completed VCP. Unfortunately, for this academic year, VCP has been drastically impacted by COVID-19. We recognize that there's a lot of uncertainty in what the upcoming application cycle for residency might look like. Many students have expressed concern about what the future will hold. And it's with these issues in mind that we're hosting a series of webinars to bring members of our Harvard Medical School residency programs and medical students together to share ideas, provide support, address questions on transitioning to the next stage of medical training, and to provide an opportunity to discuss the application process. This is the 6th webinar of this residency program series, and we're joined by program directors and resident representatives of 2 Harvard-affiliated pediatrics residency programs. And now I'd like to introduce Dr. Alden Landry, who's going to be the moderator for today's program. He's an emergency medicine doctor at Beth Israel Deaconess Medical Center and an assistant dean in the Office for Diversity, Inclusion, and Community Partnership. Dr. Landry?
Thank you, Dr. Reed, and thank you to everyone joining us for this webinar. We're excited to have this conversation and talk about pediatric residency programs here in Boston, affiliated with Harvard Medical School. And we're excited to have you join us and hear from the amazing group of panelists. Just want to go over a couple housekeeping notes. These are the thoughts and experiences of leadership and trainees here at HMS. And while we know that this is a dynamic process, we want to make sure that we defer to the AAMC, the NRMP, and ERAS for any particular scheduling or numbers, dates, and times. All of the lines are muted for a conversation. However, if you do have questions, you can reach out to us through the chat option, which is in the Q&A option, which is open. And I'll be perusing those questions to see if you have anything that we aren't covering that's really important for us and to include in this discussion. Lastly, the webinar is going to be recorded and it will be available on our website, and it should be available in the next 3 to 5 days. So if you aren't able to join us for the entire program, or if you have colleagues who are also interested in pediatrics and they weren't able to fully participate in this webinar, it will be archived on our YouTube page as well. Next slide. So I'm going to briefly introduce our program directors for this discussion. And then after that, we're going to have a little bit of a slide or sharing or two to talk about the programs in particular. And then we're really going to jump into the question and answer. After we hear from our program directors, we're going to transition and hear from our residents who are currently training here at our institutions. And they're going to offer some of their personal insight to their experiences here as a trainee. So first I want to introduce Dr. Catherine Michelson. She's the program director for the Boston Combined Residency Program, BCRP, and also an assistant professor at Boston University School of Medicine. And she's a pediatric hospitalist at Boston Medical Center. Next slide. I also want to introduce Dr. Joanna Perdomo. She's the associate program director at the Boston Combined Residency Program. She's an instructor in General Academics Pediatrics Fellow at Boston Children's Hospital and a primary care pediatrician at Boston Children's Hospital. Next. Next is Dr. Shannon Scott. She's the program director at Massachusetts General Hospital for Children, Pediatrics Residency Program. She's also an assistant professor at Harvard Medical School. Next slide. And last, Dr. Carlos Torres. He's the Associate Director for Diversity and Inclusion at Massachusetts General Hospital for Children. And he's a primary care attending at the MGH Chelsea Healthcare facility. And he's also a faculty advisor for the Office of Recruitment, Office of Recruitment and Multicultural Affairs at Harvard Medical School. Next slide. So I want to turn it over to the program director so they can have an opportunity to give you a very high level 30,000-foot view of their programs. And then during the course of the question and answer, we'll really dive into the conversation and get to a little bit more of the nitty gritty about each of the programs. Next slide. So first up is Dr. Michelson. You can talk to us about the Boston Combined Residency Program.
Thank you so much, Drs. Reed and Drs. Alden and Fari and Pinar for helping me advance slides. I didn't put any animations in there, so it would be really simple. We're really appreciative of this opportunity to be here and to speak to all of you. So thank you for those who have organized this. I want to make sure I mention that I am here speaking on behalf of the program and my co-program director, Ted Sektish, who is also a pediatric hospitalist at Boston Children's Hospital and with me leads the program. So this photo is taken from the HMS lawn several weeks ago during our intern orientation, which was mostly virtual. This was a picture of one of the opportunities we had to come together socially distanced with the interns' new BCRP masks on to take a photo and be together. And I think it's just a wonderful example of how extraordinarily things have changed for our world and our country and our profession over the last months, that it can be a potentially disorienting, but also an extremely important and powerful time to be becoming a physician, and that there is an immense call to action, duty, and clarity of purpose that has been inspiring and renewing for our profession, and that we are excited to welcome all of you into it. Pinar, you can go to the next slide. I wanted to just quickly talk through what I think is most special about the BCRP, and I think that that strength really comes first and foremost from the people who are a part of it, which we will talk about ad nauseum if you give us the chance, and the combination of three extraordinary institutions under one roof. Boston Children's Hospital, the #1 children's hospital in the country, with exceptional clinical and research missions that draw children and families from all over Boston, New England, and the world. Boston Medical Center, the largest safety net hospital in New England, with a centuries-long an unwavering commitment to exceptional care without exception and partnering with patients and communities to build cross-sector partnerships and programs that focus on structural causes of disparities and equity. We also partner with Brigham and Women's Hospital where our residents do their newborn and NICU rotations. We have 51 interns each class, so we are a large residency program, and we have residents from all over the country and all over the world, important diversity that we strive for each year. We are united by a remarkable, fierce set of shared values, an unbridled love of medicine, of science, curiosity, passion, a commitment to providing exceptional care for every single patient we encounter, and doing whatever is needed to care for the patients and families and our colleagues, for innovation, for learning in order to be the strongest leaders for the generations that come, and for diversity and equity and inclusion and the importance of representation in medicine to achieve our mission. I think that this is a powerful illustration of this. These are three photos from 3 White Coats for Black Lives events that happened at Children's, Boston Medical Center, and Brigham and Women several weeks ago and concurrently, where our residents all participated. And much to our surprise, many of our new interns showed up before their first day of orientation to be with us to protest with colleagues racism, police brutality, and the police murder of Black lives, and affirm loudly that these were our lanes. Go to the next slide. This is a very busy slide that is maybe too busy, as one of my chiefs said, but there was so much to include here about the special opportunities and highlights of our program. So first, I'm going to start in your upper right with the program's focus on leadership, scholarship, and research. We are a residency program that is excited and embraces the 2 research pathways, the integrated and the accelerated research pathway, for those who are interested in carving out significant time for research in their residency training, and are happy to talk about that with anyone who's interested. We also support the combined training programs of Peds Neuro, Peds Genetics, Peds Anesthesia, and we have a Med Peds program embedded. We have multiple academies dedicated to providing the knowledge and skills to help our residents not only become exceptional clinicians, but begin to build their professional identities as leaders in health services research and clinical research and quality improvement, innovation, medical education, and global health based on the resident-specific interests. Because of the many wonderful institutions we are a part of, there's an immense amount of funding to support resident research and resident projects. This is a picture of one of our graduates this year, Alex Power Hayes, presenting at a national hematology conference. Her work that spanned all 3 years and led to multiple publications on sickle cell disease and the disparities our patients and communities face within our care. There was 50 publications by residents in the last academic year, and they are writing not only about the research that they care about, but there are lots of opportunities and examples of residents writing about their perspectives and sharing their voices, their unique voices with the medical profession. And this is a perspective piece written a couple of months ago and published last month by 2 of our interns about being a pediatric trainee in COVID. There are residents in our program who sit on national medical education committees. Our residents are constantly leading and driving our curriculum and pointing to gaps. Health equity rounds, there's a small logo there, was an initially resident founded, but now faculty supported curriculum in the grand rounds part of our departmental education that focuses on structural racism and bias and how that impacts care that we provide. And it was turned into a medical med ed portal publication this year. On the left, you can see our really amazing focus on advocacy, which starts an intern year in our Keystone quarter, where 3 months of the year are dedicated to residents learning the landscape of Boston and the important issues that pertain to our communities here and the neighborhoods and communities we serve. It's really amazing to be in Boston, the state capital, where our residents can not only call their reps, but can show up at the State House to lobby, to testify, which our residents do often. We have, extending out from Keystone, an incredible initiative this year, the Make a Difference bulletins that describe opportunities for residents to engage in ongoing advocacy, whether they have 1 minute, 5 minutes, 30 minutes, or 60 minutes that week. And on the left is an example of one of the features of our MAD bulletin this week. It was the 3rd installment of a powerful Twitter campaign led by our residents in partnership with the 2 communication offices at our hospitals to shine a light first in their first series on disparities and mortality from COVID state by state, then to describe the woefully inadequate state-based collection and reporting of testing and mortality data. And this week, this infographic is not here showing how COVID is affecting children, doubling the % of children who will experience food insecurity in Boston this year. And the bottom left is what is probably the #1 best part of the program, our residents. They are the reason applicants come. They are the best part of the program, cited by our residents and faculty year after year. And I think we spend a lot of time and work really hard to make sure that even though we are a large program, we feel small and focused on the individuals who are here and their unique interests, their unique needs, their unique goals. And then I have a beautiful picture of Carolina here and her family. Carolina had her daughter Matilda intern year. We have a lot of residents who bring loved ones with them to Boston from all over the country and world who expand their families here, and it is a really important goal of the program that we support them alongside you, from specifically thinking about the most progressive ways to approach parental leave and return to work, but also ongoing supports for those members of your families. And then last but certainly not least, I just wanted to highlight here, and we'll have an opportunity to talk about more, the Diversity Council which is an incredible and extraordinary group in our residency and has been for many years. They have 3 arms that focus on education, on recruitment and pipeline work, and then on community and professional development and mentorship. We are excited to connect as a program with all of you and to also connect you with the Diversity Council over the next months. You can go to the next slide. We have our contact information here. We have a very active Instagram account that you are all welcome to follow, and we'd love for you to follow if you're interested. And we're excited to meet all of you in the months to come.
Awesome. Thank you for that. Next, Dr. Scott with the MGH for Children Pediatrics program.
Thank you all for organizing and arranging this. It's such a pleasure to speak to folks who are interested in the incredibly wonderful field of pediatrics. And I would echo Kate's enthusiasm and passion for the specialty. I think it's a really wonderful field where you can impact children and really kind of make a difference for their entire lives afterward. And it's a wonderfully collaborative field where we all are friends and work really well together. So it's exciting to be here. And I'm excited to, in the 5 minutes allotted, give you a brief intro to our program. So if you want to just hop, you can go right to the next slide. I wanted to give some brief, just kind of like broad strokes highlights about our program. We are, when you hear about the BCRP, we sound like a medium-sized program, but we're pretty much an upper middle-sized program around the country. And we really value the opportunity to be part of multiple integrated programs. We think that adds to the diversity of background of our residents and the discussion and like what drives people's individual passionate curiosity. So for the size of our program, we're really excited to be part of both the categorical program, but also to host Med Peds, Child Neuro, Child Psych, and to be one of the programs in the country that offer preliminary 1-year training programs in pediatrics, bringing in folks who later go on to be dermatologists, radiologists, anesthesiologists, a wide variety of specialties that need 1 year of training. We feel like that adds to our program and adds to the care of children, most importantly, who are have doctors who are incredibly well trained in pediatric care as subspecialists. One of the things that we really value here and drew many of us, actually all from our contingency trained here at some point, is the opportunity to train in a hospital within a hospital model. We really value the opportunity to care for children across their own life's continuum. So a patient with Down syndrome or a patient with autism who can be cared for throughout their entire life within the Mass General kind of home, but also the ability to care for the continuum of families, to be able to be a level 1 trauma center for adults and children so that a family in a car accident can all be cared for here together, or a postpartum mom who might need emergency care in the SICU postoperatively, or a mom who's doing well and a baby who has a congenital diaphragmatic hernia, all can be cared for under one roof. And that's a big part of why we value the opportunity to practice in a hospital within a hospital model. The last several months have given us opportunity to appreciate this fact in a way that I don't think I had ever appreciated it in the 20 years I had been here as much. And we were faced with COVID in our institution. We took care of more patients here than any hospital in the state. And that meant our pediatric trainees were not only taking care of pediatric patients who had COVID or who didn't, who had MISC later on in the pandemic, or we took care of actually a large number of children that had family members hospitalized, and a number of children, and had nowhere else to go. And one of our residents actually co-authored an op-ed in the Washington Post about the idea of COVID orphans, children whose parents and grandparents were hospitalized or very ill and unable to care for them. So there were moments where we were, as a pediatric service, caring for grandparents, parents, and children within the same family. And I think the ability to come together and really stretch people's skills and the sense of community, and to care for patients outside of our typical age range, but within the same community of nurses, physicians, trainees, respiratory therapists, and hold our units together was incredibly inspirational in the last months. We really, if you had to ask me for the one highlight that I would most want to highlight for you about the training itself, is this idea of personalized training and mentorship. We really want to get to know our residents as individuals and to help support their careers in an individual way. I like to say that while our residents resisted all options for any kind of tracks, and we made a very conscious decision not to track within our program, but to allow everyone to kind of find their own individual path through individualized training. It is also still nice to kind of have a general flow in each direction, both generalist and subspecialist, and we graduate about 50% of our residents into generalist careers and about 50% into subspecialty careers. So while we have a fiercely independent mindedness to our residents, we also have a long track record in both generalist and subspecialty careers. Advocacy and research, or really more aptly put scholarship, which I think if you look at Boyer's literature and others, like, is a much more broad view of scholarship, are really important parts of what we do every day. So whether that is our Center for Gun Violence Prevention, that is an institution-wide funded initiative, or our White Coats for Black Lives Matters work that's happening right now, our residents helping to lead the Residents and Fellows Day at the State House. We really want to have, no matter what your long-term clinical interests, to really have a sense of importance around advocating for our patients, our communities, and our patient families, and to bolster that advocacy through the really important avenues of research that allow us to be strong advocates for our patients. The next slide is not intended to show you so much like what your schedule would look like, but to come back to that idea of individualized training and to look at the purple pieces of those pies and just see that over time we really create more opportunities for you to choose your subspecialty and other electives, as you also have graduated autonomy, which we will talk to you about at length were you to interview with us. My last slide, a bit like Kate's, is, oh, I take it back, I'm sorry, there's one in between, which is, no, you're right, the next slide, I apologize, is to really highlight one of the values we see around diversity and inclusion at our institution is the chance to have so many specialties and trainees in GME who span all of the different specialties come together. And these are members of our Center for Diversity and Inclusion who span a variety of specialties and resident council. So the chance to really drive home both for our patient care, how important diversity and inclusion is, but really to be training residents who will go on to serve the communities that really want to have and need to have physicians who understand where they're coming from. And we really value the chance to do that cross-specialty here at MGH. And then the last slide, the one to which I was referring to, is our busy slide like Kate's. And I won't walk you through every picture, but really kind of want to just drive home this sense of community, because this is in fact what draws residents to our program and what makes it a special place. And I think as we talk over this next hour about the challenges of this year, the challenge we really face as program directors is how to make sure you understand our communities and value them as much as we do. And so whether these are pre-COVID pictures without masks or COVID pictures with masks, providing clinical care or having a little fun during downtime in the PICU, which is the residents learning about nasal CPAP down there, or enjoying the window washing in one of our resident rooms, and the opportunities that really have come even during this time. In the top corner, I'll just point out, is our match day celebration. And typically on match day, we don't necessarily get to celebrate with our newly matched residents, but I think that was something that we were able to do this year. And I think all of us across pediatrics are trying to, and all training programs are trying to think about how do we take the best of what we had to do during this time and make it and pull them into being things that we really see as valuable in the future as well. So I will end there because I think we have lots of things to tell you about.
Wonderful. And I just want to say thank you to the program directors for giving us sort of that broad overview of their programs. We're going to jump right into questions. I know that's why the students are here and that they have a lot of concerns. For those who are going to be answering questions, just request that you keep your answers short so we can try and get to as many questions as possible. But let's jump right in. So Kate, I'm going to go to you first. From a program director's perspective, what are your thoughts about this application cycle? And specifically, what do you think is going to be your approach now that we're going to be in this world of COVID?
I think it is the question that is on all of our minds. And I think that there are going to be a lot of changes that we are very much in the thick of thinking about and building new plans for. I honestly think some of the changes are overdue. Programs dusting off what we've done for many years and rethinking about how to focus on what's most critical to communicate and how to best showcase what we believe is so special about our program. We've talked about going virtual before because of the immense cost and issues of access. And I think this is a wonderful occasion to do that. It decreases travel burden and hopefully alleviates the expenses of a very expensive fourth year for fourth year students. I think there is going to be, as I said, a significant amount of work around trying to figure out how we most effectively virtually communicate to you guys what is special and what we hope you take away from our program and what our values are and what our feel is and what our goals are. I think there's going to be great opportunities to be more comfortable than before, but we're going to also have to figure out how to make it feel like a safe virtual space. I know a lot of worries that all of you have are about changes to your third and fourth year and parts of your application that are going to be different because of how COVID has affected those years. And I want to reassure you, and we're going to, I think, say this multiple times over, that all of us are so aware of those differences, and then also geographically what areas have been hardest hit during what periods of the last 2 years, and are planning accordingly. The BCRP has a long-standing history of doing holistic application review, reading every single line without a filter for step 1 scores, for step 2 scores, for grades, because we think those are such poor predictors of who you guys are in total. And that is going to be more important than ever this year to understand what your experience has been. I think we're trying, and I saw a question come in about this, to also predict how you guys are going to change your behaviors. Are you going to be applying to more programs? Are you going to be applying to a more restricted number of programs that are closer to home? Because there's a lot of reasons for many to want to be closer to family during this time. And we're going to partner with you guys to figure that out. And then we're losing lots of opportunities through the summer and fall to interact with you guys in the loss of VCP and figuring out how to supplement that information sharing in the best way possible. I'll stop there.
Perfect. Thank you for that. And Shannon, I had a question for you. What are you all doing over at MGH for Children to prepare for this application cycle?
And the really neat thing about the pediatrics community is I can answer this question about what we're doing nationally. Like, I want to reassure folks who are going into pediatrics that there's actually an incredibly integrated approach to this that's happening nationally. So we're all thinking together about how to make this experience a positive one for all of you. We are certainly, like, I think of it a little like when we say, like, don't worry about, you know, the puppy is more afraid of you than you are of them. We're nervous, right? We don't know how this is going to go, but we know that you're nervous too. And I have always felt that way about recruitment in general. It's a time where everybody's a little nervous, and so we're coming in with the joy we have for pediatrics and for training, and really thinking about how to use this as an opportunity. How do we actually make things more convenient for folks? Before we had to stuff everything into one day. We expect over the summer to probably have some web-based Q&A options. There was a question about, like, joining conferences, whether we'll have that built into our like interview process or have some open opportunities. We're still working those things out, but those are the kinds of things, like we're really thinking about how do we make sure that we plan our, the days have to, even if you were to sort of just transfer to virtual, that would be a disadvantage depending on what time zone you were in. So we really need to think about like even just the timing of our days. And as Kate said, how do you make virtual space feel safe like it would during a happy hour or during a kind of Q&A with residents? And, whether that's Zoom chat rooms or the opportunities to ask residents questions offline and things like that. So we're thinking about all of those things, knowing that this is going to be an uncertain time for all of us. And there's nothing that the last several months haven't taught me more than the value of sharing our uncertainty together and sharing our vulnerability. And we intend as program directors to do that with you over the coming months and ask your grace as we go through this together.
Perfect, thank you. And Joanna, what are students saying to you about their concerns? What are you hearing from students as they approach this upcoming application cycle?
Hi, everyone. Thank you for having me here and us here. I think to echo a lot of what Shannon said and what Kate said before, uncertainty is the word of the day. So all the uncertainty in the world extends into this process for us and for you all. And so things we've heard and are working actively to address are, how is a virtual interview day going to go? How is it going to be structured? What technologies will be needed? Is there a dress code? Who and how will you meet people, residents and faculty? How will you get a sense of what the hospitals are like? How will you get a sense of what the city's like without being here in person? There's similar worries about fourth year and third year of med school, how applications will be viewed with or without a sub-I or certain rotations, which I know we'll, I think, have time to talk about more later. Similar concerns as well around letters of recommendation and how people will get strong letters if they have less face time with letter writers, or maybe haven't had a pediatric sub-I and a letter writer will be not from pediatrics. We want to, I think, reassure everyone that none of these things, these concerns, are going to serve as red flags in an application. The reviews are always holistic and will, as everyone has said, have an even more holistic and understanding eye to everything, because as Shannon so wonderfully put, like, we're in this with you. So those are a lot of questions that have come up. I see a lot in the Q&A too, and I think we'll have a chance to address a lot of these hopefully in this hour.
Yeah, I agree. There's some great questions coming in. Trust me, I know that you all have questions that you think are very particular to you, but we're going to try and get to all of those questions with our very generalized questions to our panelists. And I think you'll find the nuggets that you are looking for as part of this discussion. I have a question for both Kate and Carlos. And it's really around diversity in your programs. You've mentioned it in some of the introductory slides, but I'll go to you first, Kate, and then to Carlos. What are you doing in your program to increase diversity, promote inclusion and belonging in your program?
Yeah, this is a huge priority for us, has been and absolutely is continuing to be, and I think is something we're thinking about from a number of different angles. First, ensuring engagement and investment with local and also national pipeline programs, mentorship as a proximal step. I think we are and for a number of years have made changes each year to ensuring our recruitment is as robust as possible for ensuring a diverse class. We want to make sure that we can create ample opportunities for each of you to interact with our program in advance of a decision to apply, if that is helpful to you, so that you can ask all sorts of questions and have us answer about our program, about our institutions, about the city of Boston, in order to understand how you would be supported and nurtured and could thrive and do the work you feel most passionate about doing successfully here. Our goal in BCRP, as we reimagine every aspect of recruitment, is to make sure that we are providing virtual opportunities to do that. And so for people who were going to participate in the virtual Clerkship program or had other interests, even if they were not planning to come, so that you can participate in resident panels, faculty panels. We are working to create a calendar of teaching conferences so that you can see what those are like at our institutions and resident social events, and are eager to hear from you if there are other parts of the program that we could open virtually for you to see. We have a really wonderful program called Council Connect that pairs applicants with residents throughout the interview season. So that they can have a buddy and someone to ask any and all questions to. And we're going to make sure that is robust enough to support anyone with interest this year through the summer and fall, but then also through the interview season. We are, I think, very aware and committed to continuously interrogating where bias exists in applications in our interview process, especially with virtual interviews, as we've mentioned, to performing holistic reviews of applications and training our interviewers and selection committees to address and minimize these biases. And this will be our third year offering a funded second look for applicants from underrepresented groups in medicine to return if they are interested. And we, without having any clue what the landscape is going to look like from COVID in January, are still unclear whether that will be an in-person opportunity to meet you guys for the first time or a virtual experience. And then I think lastly, but really importantly, is to ensure that when residents are here, that they are welcomed into an inclusive community where they feel fully supported and able to thrive and hopefully want to stay for a long, long time. We have an amazing diversity council. We have 2 designated diversity chief residents, 2 associate program directors, and a faculty diversity officer, Camilla Mateo, all with supported time to advance diversity, equity, and anti-racism priorities in the program, recognizing that if our climate is not right, we can recruit and recruit and recruit, but that we won't be able to retain. And I think as the nations responded to the events of the last month, the importance of this has really taken center stage in our residency and driven home the fact that intention is insufficient and that specific, deliberate, continuous engagement and action is necessary, with a real focus on results and what the climate is, and ensuring it is continuously growing and receiving feedback and improving. We built an action plan over the last weeks with our residents and faculty that has outlined a bunch of immediate steps we've just taken, and short and medium term steps that we're happy to talk to any of you guys about. And our leadership, I think, in the domain of climate is thinking about representation at all levels: who teaches, who leads, who's making decisions, how to address the minority attacks by leveraging funding and time and support, ensuring mentorship of residents so that their incredible work in these spaces can be turned into scholarship, investing in time to educate and train residents and staff and faculty about the history of racism and structural racism and bias, both in formal ways, but also woven through our clinical learning environments. And then interrogating where bias exists within our program structures and addressing it head on. We're really lucky to partner with 2 amazing offices, the Office of Health Equity and Inclusion at Children's and the Office of Minority Physician Recruitment for graduate medical education at BMC. And we hope, if you have not yet had a chance, that we'll be able to introduce you to Nikki Tennerman and Valerie Ward and Shonda Walker, who are phenomenal and are incredible partners to us in this work. I'll stop there.
Great. And Carlos, similar question to you. What's happening at MGH for Children?
Yes, thank you for having us again. And I'll keep it a little bit shorter in the sense that diversity has always been a cornerstone of what we do, even before it was the cool thing to do. I trained at MGH, and even then, many years ago, it was already something that was very important. And we actually have a diversity and inclusion team made up of 3 pediatricians who oversee this work for diversity in the whole Department of Pediatrics. And we also sit in the match rank committee list in the intern recruitment team. We also have a very active diversity committee that serves as our advisory board. And very similarly, we have a three-pronged approach with that, and that keeps expanding. We focus on recruitment. We're very active participants of the VCP. We also focus on education, and we have an anti-racism curriculum that we've been doing for the residents for the past 10 years, I believe. And now we're expanding it to nurses and attendings, because we also understand that the realm of control of a residence expands much further. So we want to make sure that we have our allies who do a lot of work with us. And then the other thing is that being one of the benefits of being a hospital within a hospital is that we have an amazing center, the Center for Diversity and Inclusion, which has been around for over 20 years. So we get to benefit from their funding, their learning, and also that institutional memory that helps us move forward and push agenda items out. And we have a newly appointed person, Joe Benterkert, who is the Vice President of Equity, who is working very closely with our department and kind of getting some agenda items out as well.
Wonderful. Thank you, Carlos. And so I really want to jump into this quickly, and I want to make sure that we allot time for a number of questions. So panelists, I ask that you keep your answers relatively brief so we can move through these questions. And I'll turn to you, Shannon. What tips do you have for students who are trying to make sure that pediatrics is the right choice for them? And, you know, especially for those students who may have had their pediatrics rotations cut short due to COVID.
Find your passion. And I suspect you can feel passionate even if you haven't been in physical clinical spaces. And I think even though I know a lot of sub-Is have been shortened, there are definite opportunities, I think, to work with patients and work with pediatric patients if it's virtually. I think you can see whether that is resonating for you, and talk to mentors. It is okay to still be undecided. I know there were a couple of messages about like thinking about a couple of fields still. We recognize that this year people may take a little longer to figure out for sure what they want to do. So I would really like spend some time thinking about what were the moments that you kind of wanted to read more, or you wanted to go back to a chart and see how somebody did, or you circle back to a patient's room at the end of the day. And I think an untapped resource that many of us don't use enough is checking in with our loved ones. Most parents and significant others don't want to take over and tell you what to do, but when asked to reflect on when you've been happiest, they often can tell you. And I think it's very common for people to say, oh, I'm going to go into pediatrics, and then have their family say like, yeah, we knew that a long time ago. So test that out, talk to pediatricians. We often have, you know, we were talking about Twitter at the very beginning. I often have folks who like reach out in that means, and we'll, you know, share a couple of messages that way. So I think there are a lot of opportunities to talk with people and just feel like if it's really resonating for you.
And Carlos, you just mentioned this earlier about the Visiting Clerkship Program and your involvement in our program. Unfortunately, we don't have OA rotations this cycle, and it's really a detriment to both the programs and to students. How can students start to do their research without actually having those on-the-ground experiences with the programs that they're potentially going to apply to?
Well, I think a lot of the programs usually have websites, so I think that may be a good starting point that are pretty up to date and have oftentimes very good information. So I would use that as a starting point. The other thing is talking to people, right? Just because you cannot do an away rotation does not mean that you cannot talk to either the program directors, residents, faculty. So it may take a little bit more of activation energy, but I would really encourage you to press send on that email and either send a few questions that way, or set up a time to talk to either those people that I mentioned, and particularly residents, because they will definitely give you the true feel of that program.
Yeah, great. And I think that's sage advice right there. Don't be afraid to press send. Just make sure you proofread your email before you do press send. Joanna, there's a lot of discussion right now about culture, right? About what the feel of a program is. And again, students can't come here and rotate with us. There's a lot of misinformation that's out on the web. How can students learn about the culture of the program? And is there value in reaching out not only to the program directors, but also to some of the trainees that may be in place, or maybe some of the faculty?
Yeah, this is another huge challenge to this year, particularly. And so we're working on several ways to try to give applicants more of a feel of what it's like here in the BCRP. So first, we're making updates to our website to reflect not only rote information, but a lot of more of what the feel of a day in the life of the program is like, with more photos, videos, etc. Second, I would encourage anyone who has Instagram to follow at BCRPgram, where that's really will give you a really good sense of a day in the life. There's continuous updates throughout the day, whether it's, you know, shouting out something a resident did, to seeing what they're eating for lunch, to seeing something silly going on in a workroom. So as trite as that sounds, I think Instagram might be your key to learning some about our culture. We are going to be getting a list of everyone who's on today's webinar. And so through that, we'll be able to reach out with opportunities to learn more about the program, which includes coming to some teaching conferences, coming to a faculty panel, and also our rising chiefs are even trying to work on hosting a virtual happy hour where would be able to get to meet residents. So those are some ways that we hope to share what we're like here.
Perfect. I actually think that you all are the first program of all the programs that we've done webinars with to have an Instagram account. So that's pretty cool of y'all. All right, Kate.
HFC Peds.
Okay. Hey, Kate, you know, this is a question I've seen in the chat discussion. There's a lot of students who are going to be applying. They're students coming from across the country that apply to our programs. But there may not be that geographical or regional tie. And so how can students truly express their interest in a program if they're coming from a place that maybe hasn't had a resident for a few years or ever to come from that medical school, or parts of that country where you don't typically see a lot of applicants?
Yeah, we are so excited about that. And I think having people apply and match into our program from new schools is such a fantastic part of us expanding one type of really critical diversity for our program. So I think that is great. If I can imagine that there are questions related to that too. I think a quick email to the program directors, if you want, although I don't think that's needed either, for us to really see you as an exceptional and exciting candidate, so that we can answer questions if you have them, especially without potentially alumnus from your medical school in the recent years to answer them. So feel free to email, but we will be excited to see your application.
Awesome. And so Shannon, another round of questions around sort of the clinical skills and evaluations component of the application. We talked about this briefly. Students were participating in rotations, and then COVID happened and they were pulled out of the wards. And so some of their third year may have been compromised, and some of their grades may have been changed to pass fail. So how are you going to look at those applications, and are you going to look at them any different than you would in the past?
We totally understand that your year was changed, right? And I think with a rising senior in high school, I recognize the anxiety that goes along with a quarter of a very important year being pass-fail, because that's an anxiety in my household too. But what I want to reassure people about is that we see clinical skills across the continuum of all the care of patients that you took care of. And so if your pediatrics rotation, for instance, was at the end of the year and was canceled or like dramatically changed, we understand that. We were always looking across the board at all of your clinical rotations. And so we will recognize that we're going to see more about comments about your clinical abilities during those times that were more typical, and that we may see different comments or very few later on. And we will, you know, your MSPEs will include what was pass fail versus not. And so we've been used to, for a long time, looking at very different kinds of MSPEs depending on which school you're coming from, and being able to kind of really look fully at people's application. I think this is particularly true in pediatrics, that we are really interested in you as a whole person and as a whole physician, and that it isn't one make or break thing. At Mass General, we also don't use any cutoffs, like kind of screening cutoffs. So we are looking at people's whole application and not sort of having electronic systems kind of screen people in or out. So please know that we recognize, and we've been in the thick of it also, and so it's very much on our minds in particular, I think in the Boston area, knowing that, that this has not been typical times. And as we're counseling our residents who are applying for fellowships, we are trusting that those fellowship directors are doing the same thing that we are going to do, which is really understand the situation is quite unique.
Wonderful, thank you. And Joanna, a similar question, but this is more pertaining towards fourth year rotations. With everyone's timing being off, some students are having shorter rotations for their sub-Is, and other students may not be able to do their sub-Is until later in the process, potentially not even before they even submit their application for residency. So what should students do to make sure they have the right stuff when it comes to rotations as a part of their application?
Yeah, I think continuing on the theme, I don't think there can be a right now, because a lot of what would be right in a normal year is just completely out of your control, and we understand that. And so what you've been able to do thus far and what you're able to do right now, or what you're not able to do, is what it is. And we are totally understanding of that. And again, we'll take a holistic approach as always to your applications. And like Shannon said, you know, your clinical performance in a sub-I versus a PEDS rotation, which may seem like the most important things to a pediatric program, actually can be gleaned from looking at an internal medicine rotation, a family medicine rotation, an OB rotation, an advocacy rotation. There's a lot that we are able to see from an application, and especially in this unique year that we'll take into account. So we don't really want anyone thinking that they're missing out on the right thing, because there really is no right this year.
Yeah, I think we as both programs and also the applicants are going to just have to roll with it and to just expect that it's not going to be the pretty pictures that both sides were expecting. So, Kate, can you talk a little bit about letters of recommendation? Some students used to rely on those away rotations to get strong letters of recommendation for that outside validation. And oftentimes that's not going to be there for COVID this year. So what should students be doing to look for those strong letters of recommendations? In particular, who should they be asking?
Yeah, I think this is true in prior years too, but with even more so this year, that more than anything, what specialty they come from, you know, where they are working, what experience they have, people who know you best and who will commit the time to sharing what they know about you on paper is, I think, the first, second, and third most important criteria. That, you know, we will be thrilled if there is a PEDS letter. We recognize that there will be applications this year that don't have a PEDS letter because of the timing of their core clerkships and sub-Is. And so I think, just as Joanna said, we are very special. We think we're very special, but we're also very similar to so many of the other specialties in practice. And so getting someone who has seen you work on an internal medicine unit, on OB, on family, those really can speak to many of the same things a PEDS letter would. And so use your advisors to think through that list. But I think the typical is different this year, and that is totally fine.
Perfect. Yeah, and I think it's really important to understand that you want to find individuals who will write a strong letter for you. And if they're not necessarily the department chair or the most senior person with the most NIH dollars in their grants, it's okay, as long as that letter speaks really highly of you as an applicant. Another major important part of the application is the personal statement. Carlos, we're all dealing with COVID. How much should students talk about COVID as a part of their personal statement, if at all? And also, what else, just any general tips for what makes a strong personal statement?
So in terms of the personal statement, we tend to read all of the personal statements that for the applications that we look at. And in general, I like to see when you tell us your story. Tell us what makes you passionate. Like, what are you passionate about? It's a really nice way to get to know a person. So the story, struggles. For pediatrics, why did you decide on a career in pediatrics? In regards to the COVID part, I think that if it's a really important part of your story, obviously it impacted all of us tremendously. I would not necessarily just include it just to include it, because we're all impacted by it. But if there was a particular part that resonated with you in regards to COVID, I would include it. But if it's not relevant, I would probably leave it out.
Yeah, thank you. Just be careful. You want your personal statement to be both personal and a statement, and you want to make sure that it is strong and speaks to you well. So think about what you put in that part of your application before pressing submit. Joanna, another tough question for you. Students may not be the greatest test takers. They didn't necessarily perform well on step 1, or they may have a weak rotation during their 3rd year, and they didn't do too well on the evaluations there. What can students do to overcome those weaker performances, either on step 1 or during a core clerkship?
Yeah, so I mean, step 1 and clerkship exams are only a measure of test taking abilities, and not a great one at that, which is part of the reason why they're going to pass fail. We read every single word, every single letter of your application, and like MGH, do not screen out at all based on any score cutoffs or grade cutoffs, and want to know you through your application, and that's the entire you. Your passions, your successes, your challenges as well. I think if you've had a challenge on an exam or a clerkship, if there was a true failure, you can work with a med school advisor to help explain this if you wish. But if you merely perceive that it's a low score in itself, we don't require any explanation of that at all.
Great. And Shannon, we're thinking about step 2 as well in this in a similar vein. Obviously, clinical skills has been canceled for this year, but CK is still around. So what are your thoughts about students who haven't taken CK and they're going to apply? And should that impact their sort of timing of their application process, or any other thoughts about how CK may be an impact to this application cycle?
Do not wait to apply, even if you think your CK is coming soon, because I think my recommendation to everybody is to have your application up and ready when programs can begin to download them, and in particular this year with a shortened time frame for us to be able to look at them. We, and I think this is true at the BCRP too, never required CK or CS for an application because it's had previously been a requirement to be appointed here once you started residency. We asked for them at the time of the rank order list being due as a mere pass-fail kind of so we knew that people would be able to start residency. This year, we recognize that that may not be feasible for everyone because of the timing, and who knows with later surges and depending on what parts of the country you're in. So we will waive that this year. And while if you have that score, we will, make it a data point. I'm a big believer in these tests numbers being useless to us, and really it's more of a pass-fail marker for us. So I would not worry. We all recognize that things well outside of your control led to these not being able to be done. And again, as a mom of somebody whose SAT was canceled, I promise you, we actually really understand the stress of not having that score, even while we reassure you.
Yeah, definitely. Thanks for sharing the personal aspect of it as well. Joanna, I feel like I could give you a lot of the tough questions. So, but I think this is also something that's really important. How are you as an associate program director, and then also someone who is helping to organize this and train people for this virtual interview space. How are you all preparing for virtual interviews as a program?
Yeah, I think pretty early on, once we recognized what the fate of this interview season would be, we swung into action. So our selection committee is in full swing to prepare for the virtual interview season, including our rising chiefs who are hard at work on this and are coming up with a lot of creative and innovative ways to make the day engaging and informative and as fun as it would have been in person, while also working to minimize Zoom fatigue, which we know is a real thing. So just some things to hopefully look forward to are a shorter interview day than we usually have. And in favor of that, really thinking about, what's important for people to get kind of in the moment, things like seeing how people teach and learn, how people interact, connecting with residents, and leaving some things that people can do on their own time or asynchronously, like hospital tours or explaining what the whole year is like, or seeing a little like day in the life as things that people can explore on their own time. Kate mentioned this, but we have been always, but are even more so in the virtual era, actively working on how to mitigate bias in virtual interview settings. So for example, standardizing Zoom backgrounds so there isn't bias based on how a person's home might look. Our selection committee leadership is receiving training on bias in the virtual interview process, and training on implicit bias and microaggressions as well. And then we hope that throughout our interview day, we can create smaller breakout opportunities for applicants to meet with residents and faculty on key topic areas. So you have more intimate settings to ask questions and learn about the program. And in general, this year, we are thinking of having a smaller group of interviewers who are more comfortable with the virtual interview setting, rather than someone who might only be doing this once and feel less comfortable with the platform. And then on the more fun end of things, our rising chief residents are thinking of all sorts of fun ways to create opportunities for people to come together, such as game nights, paint nights, virtual happy hours, and things you can do, maybe not just the one day that your interview scheduled, but more spread out over time. So lots of, opportunity for innovation and hopefully positive change that will come out of this.
I like the idea of expanding it beyond an interview day and making it an interview sort of interactive season. So that's a great idea. Carlos, similar question, but from the student perspective, what can students be doing to prep themselves for virtual interviews?
So I think it was said earlier, but I really want to emphasize that this is new for everyone, right? So please be forgiving of yourself and of us as we learn this aspect. I think in general, I would look out, a lot of people are thinking about this. So I would look out for guidelines that are established by either the AMC or the AAP. I'm sure there's going to be a lot more coming out because they can offer some general tips. As for some general tips, I would always say that you want to think about finding a quiet space if you can. If you cannot, see if you could go to the library or even your medical school. Sometimes they'll offer rooms that you can check out. And I think the biggest thing, as in real life, like in-person interviews, I would definitely allow yourself to be yourself. I think that's the best. That's when we really get to know you and you get to know us. So I think that wouldn't change at all.
Great, thank you. And Kate, the question that I've seen popping up a couple times in the conversation, which is students communicating with residency programs, this time after the application cycle has begun. So what would you say for a student who has already applied about engaging a program both before they get offered an interview, or if they get offered an interview or they don't get offered an interview, or let's say they interview and they had good vibes, but they want to make sure that they are, feeling the same love from the program?
Yeah, I'll quickly take each of those. I think we absolutely welcome email communication in our direction so that we can help you get the information you need. We are notoriously late in sending out invitations. For years and years, I think we are one of the latest programs to send out our invitations, usually late October, and this year it'll probably be mid-November. And so we get these each year from people who are really excited about coming to Boston and the programs here and are writing because they haven't heard. We do that because it takes us time to read each of them line by line, but also we want to make sure we only offer to those that we can have come through. We don't have a wait list, and so we spend an extra week or so trying to get those numbers right. And so please email us if you want to share a new piece of news or something that has changed in your application, but know that we are working very hard to get those invitations out as soon as possible, and that we're just a later program in doing it. I think Dr. Landy's second question about, wanting to express interest afterwards. There are lots of specialties, and I think Shannon and I probably both agree about this. Peds is not yet there, but would love us to be there, where there is no communication from us just because of the burden that creates for you guys. I think we, on the flip side of that coin though, want to be completely available to connect you with the resources to answer lingering questions for you as it pertains to imagining your professional life, your personal life here. And so again, feel free to reach out to us, but we are increasingly trying as a program and then as a specialty to not bombard you in the opposite direction with communications after the interview.
Great. And I have one last question for our faculty, and I want to direct this to both Shannon and Joanna. Your residents have gone through a lot these past couple months with managing COVID. We've talked about that briefly in some of your slides, but can you just talk about how both your trainees responded to COVID, and then also how the institution supported the trainees during this very different time? And I'll go to Shannon first and then to you, Joanna.
Sure. Our trainees were nothing short of extraordinary and inspirational to me every single day. There was a lot done to support them, but it really was their willingness to do what was needed and to stand up and be there for our most vulnerable patients that I think that really made this time incredible. A couple of things to highlight institutionally. One was the support provided both by other trainees, and in particular our Med Peds residents were incredible during this, but also our adult hospitalists who helped sort of put their arms around our pediatric services, who are expanding our age range to care for adults. It expanded to having medicine residents come into the PICU that had become a MICU and work side by side with the pediatric residents who were the responding clinicians to support them and be a constant kind of backup to them and kind of support. And then there were amazing things. Carlos and a number of our faculty were part, and non-faculty like were part of what was called the Spanish language group. And this was a group of Spanish-speaking physicians who were available to our inpatient units to expand the services our interpreter services could do, because they could actually provide kind of this bridge between the clinical medicine and speaking to our patient population. The MGH cares for a huge Spanish speaking population in Chelsea and the surrounding areas that were the hardest hit areas during COVID, and to watch how the institution thought kind of outside the box about how to support limited English proficiency and Spanish speaking families during this time, I think brought great peace to and support to the trainees who were helping care for patients during this time. And the other piece is just sort of the expansion of online capabilities for virtual visits and the ability to have residents participate in virtual visits in meaningful ways that I think have also really expanded our ability to care for pediatric patients who are not coming into the hospitals across the country, we know this to be true, in the same numbers. Critically ill kids, absolutely, but the sort of more mildly ill kids, for lots of different reasons, both for families being nervous and for the fact that it turns out if you don't have kids spend a lot of time together, they don't get as sick. So those opportunities, kind of think about how we educationally like fill around the difference in patient, I think has been really great.
And Joanna, same question.
Yeah, so I think our residents and our program have just shown with resiliency throughout COVID. And I think with our program having, you know, a freestanding children's hospital and then pediatric units within a larger hospital, COVID was felt differently at the two different institutions and differently by the different residents working there. So at Boston Children's, our residents there were kind of slimming down services for safety and infection risk exposure, while also preparing to potentially take in a lot more children from around the region as a lot of pediatric units were closing. And residents just stepped up to the task and were there every day, even if they were kind of the only people with social distanced workrooms that weren't as fun as usual. They stepped up and made it that way. At Boston Medical Center, our pediatric ward and PICU closed temporarily to make space for adult COVID patients. And then soon thereafter, our pediatric residents we were asked to have people volunteer to be on adult COVID services, which was, I think, nerve-wracking for us as program leadership. And then when we reached out to residents for, you know, a couple of volunteers, we heard from nearly 2/3 of the residency program, and everyone wanted to be there. And our residents were just so quickly taken into the arms of our family medicine colleagues who kind of mentored them through taking care of adult patients. And they really, I think, served as leaders very quickly on those units as well. On other fronts, our residents led in cross-institutional journal clubs on COVID and the basic science emerging during COVID, as well as on the health inequities around COVID and advocacy opportunities. Out of COVID emerged some great things, like an advocacy group that initially was specific to COVID, where on a daily basis, opportunities were being shared around petitions to sign, calls to legislators to make places to donate time or goods and relevant news. And then I think as well, our community just kind of came together, whether it was for game nights or paint nights hosted by residents or cooking nights hosted by faculty and residents. In a way, I think we've seen more of each other than we usually would have. And kind of everyone's come together in this time, and we'll continue to do that moving forward as well. That's just a few things I can say.
Wonderful. I want to say thank you to the faculty for joining us. Thank you, Dr. Scott, Dr. Perdomo, Dr. Michelson, and Dr. Torres for joining us. I want to quickly transition to our resident component of our discussion. So if we can go into that next slide, please. So we have a handful of residents who are joining us from the two programs. They're going to be answering a couple questions, and we're going to try and see if we can squeeze in one or two more from the audience. So first is going to be Dr. Nunya Achulano, who is a second-year pediatrics resident at MGH Hospital for Children. Next slide. Next, we have Dr. Christine Martin, who is a second-year resident also at MGH for Children. Next slide. We also have Dr. Tyler Renier. She is a pediatric chief resident at the Boston Combined Residency Program. Next slide. And last but not least, Dr. Daniel Zhang, who is a pediatric chief resident at the Boston Children's Residency Program. Next slide. I think that should be it. So we're going to jump right into the questions. And so maybe I'll go with both Nanya and Tyler for this question. What would you describe as the culture of your program, and how did you come up with when you were thinking about programs, how did it differ itself compared to other programs that you were applying to?
Hi, I guess I'll go first. Thank you guys so much for having me. So that's a really good question. And I think that was probably one of the main like decision points between my first, second, third, fourth ranks. I feel like the culture of Mass General for children I wouldn't say that it was better than all the programs that I've been to, but I would say that it really did prioritize that culture. And I say that by the fact that they don't just see diversity as the way that you look, but they also see diversity as where you come from, the kind of personality that you have, the interests that you have. There were so many differences in all of the residents that I interacted with that made me feel like I had somebody to look up to, somebody to mentor me, somebody that I could hang out with, somebody I could run ideas by. And I just felt like there was always someone there for me, that I wouldn't feel alone. And, you know, in a lot of programs, I think that they want to just kind of fit the status quo, fit the pretty picture of what their residents should be. But I think once you get into a residency program, a lot of the times you're going to be working with these people day in and day out, and you need to be able to have somebody that you can relate to and somebody that can be your person in any rotation or any shift that you're working on. So I do think that the culture of our program is prioritized, and it's also something that made this residency experience pretty beneficial for me, especially in my intern year.
Wonderful. Tyler, similar question.
Similar answer. I think that the thing that drew me to the BCRP was like absolutely hands down the community, and to echo what's already been said, the culture of being at work with your friends is just a huge part of what makes what we do enjoyable. It's hard and long hours that we work, and 3 years is a long time to be training, and to be able to be responding to consults at 3 o'clock in the morning alongside your best friends is what makes training so fulfilling. And I'll also extend that to all of the program leadership and faculty that we integrate with. I think there were many programs that I felt that sense of community, friendship, family really within the residents, but to see it as a priority for all of our faculty and our program leadership felt like a unique experience to me before getting here, that I could call people their first names, even though they were the division chief, for example, or the program director. So it felt to me like a program that informal and friendly environment kind of infiltrated all of the communication, the interview day, and has definitely been true of me being here now. And just to echo the real sense of kind of diversity and inclusion in that, not only being resident driven and led from the bottom up, which I feel like is central to a lot of programs, but really having our leadership listen to us and proactively make changes that are driven by the resident, but also come from the top down as well. And I would go back and make the same decision. That's why I'm doing chief residency here. This is my family and I love it.
Awesome, thank you. Nanya, I think we've heard about this from the program director's perspective. And Dr. Scott told us what her thoughts were, but how can you share with us your experiences in being a trainee here during COVID?
Yeah, of course. Thank you so much for asking. So obviously, just like the rest of the country, there was always that initial fear, that anxiety, that, you know, we didn't know much about the virus. We didn't know how it was going to affect ourselves, our family. We didn't know how it was going to affect our training. And, you know, that fear and anxiety was definitely prominent, but I would say it was short-lived, because the way that Mass General was able to anticipate our fears and our anxieties way before, you know, the wave hit the United States was tremendous. The resources, the emails, the lectures, everything prepared us weeks before the United States saw the worst of the COVID pandemic. I would say that we were prepared not only from our med-peds colleagues, but like Dr. Scott Bernali has said, we got a lot of leadership and mentorship from the internal medicine cohort, and also a lot of our hospitalists stepped into roles that made it so that we were properly supervised and also had a leader that we could look onto. And a lot of people were struggling with, you know, their own self-care as well. And I feel like in our program that was prioritized. The leadership in our program knew that we were taking on something that we've never done before, and following the course of a pandemic that we didn't have much knowledge on. So they knew that, you know, with giving us the space to have self-directed learning, you know, spend more time with our family, you know, be able to debrief on a lot of the cases that we were seeing, I think that was really beneficial for us being able to last the effects of the pandemic so far. And I also really felt kind of empowered because, you know, it was more like there was never a question on whether or not our residents could, you know, stand up to this disease. Like, I felt like the program and the hospital in its entirety felt that we were all well equipped to manage and treat patients. And I felt like that made me feel like I was at the right place because they trusted me to take care of these patients, and they gave us every single resource that we needed. Of course, you know, there were times where I really wished that I could just go back to treating PD patients and, you know, see like our typical bread and butter, but everything was like a learning experience. And at the end of the day, I did feel like if anyone was struggling or if anyone was experiencing any sort of anxiety or stress, their needs were listened to, and people were able to work to their own strengths as much as they were able to during the time period, which was really nice.
Awesome, thank you for that. And going to you, Tyler, again, can you talk about your experience, not in the hospital per se, but in Boston during this time? And you know, what did you know about Boston upon coming here, and how have you seen Boston change given our experiences with COVID?
Yeah, so I am actually from Central Mass, so like close-ish to Boston, but I'll say I spent a decade outside of Boston before coming back for residency, and was honestly a little apprehensive about having been in New York and then Philadelphia, returning to Boston and having concerns about potential lack of diversity, finding community as a physician trainee of color, and also part of the LGBT community. And I have really found a home in Boston and within my program in terms of being a physician of color, being a queer physician, and getting to take care of diverse patients, and really feeling bonded and committed to that work at both Children's and BMC, and I'm sure they would echo this of MGH as well because of the community that we have in Boston. I think the thing that changed, I wouldn't call it a change as much as reinvestment during the COVID pandemic, is that Boston is an incredibly strong community, is a very diverse community, and has ongoing struggles like many other cities in the United States, especially during this national discussion around racism and anti-racism efforts of things like segregation and social deprivation differences in the regionality of Boston that we saw really sharpen during the COVID pandemic, hitting communities of color much more substantially. And the thing that I saw Boston do was really to confront that head on, both in the way that our hospitals took care of patients in a holistic way, and thinking about the role of essential workers and that disproportionate burden, thinking about how we could affect change on a legislative level, from ending evictions during COVID to how pediatric residents can contribute to adult care, and really refocusing our energy on directly addressing the health disparities and inequities that resulted and are ongoing from the COVID pandemic as a city.
Great, thank you. Christine, I want to turn to you. Part of the growth and development of a physician is mentorship. Can you talk about the support that you've received in the form of mentorship here, and how is your program helping you to grow?
Yeah, thanks for having me. I think that that's also a great question. I think Boston in itself is a really great place to live, work, and train, because it's a very academic-minded community and city. And there are like MDs everywhere, whether you're at MGH or BCRP. And because it's such an academic-minded community, there are always people working on projects that want new, fresh minds to help them and work with them. So truly all you have to do is say, oh, I have a question about this, or I'm really curious about this. And you tell someone, and they just introduce you to someone who could potentially be a mentor for you. And I think that in understanding that Boston has so many different levels of access for working on, whether it's like advocacy, whether you want to do like true bench research, whether you want to focus more like on clinical avenues, there's always someone there to help you sort of figure out your next steps in your overall career path. And I know, like personally for myself, I've just been sort of like musing with senior residents in the room about what I'm interested in. And then they'll say, oh my goodness, you have to meet this person. And they set us up via email. And now I get to work on several projects that I don't think I would have had the opportunity to had I not been at Mass General for Children. And then I think when I think about what I've gained most from my program, I really think it's a sense of confidence. And I feel very grateful for that. I think that our program not only gives you like the independence to think freely for yourself and really think about where you want to be 5-10 years from now, but they also really instill a sense of confidence in not only your dream, but also your clinical judgment. And that was something that I was really hoping for when I started residency. And I think that our program, you just see this like really wonderful exponential growth over, like I can even say over my first year, that I didn't think that I would have gained otherwise. So.
All right, perfect, thank you. And to you, Daniel, you're nearing the end of your training. You're doing this chief year. How has your training at your program shaped your decisions going forward? In particular, thinking about advocacy, thinking about interest in patient populations that you provide care for, thinking about further training that you may want to acquire in the form of fellowship. What did your program have in place to help put you in the best position going forward?
Yeah, absolutely. That's a great question. And thank you, Alden, to you and your team for putting together this event and for having me here as part of it. I think I would start by just saying that I am so grateful to the BCRP for having opened up every door of opportunity and really preparing me to feel ready and unafraid for this next phase of training. And that's because of the incredibly rigorous but well-supported clinical training that I've received here. As Kate alluded to earlier in talking about that overview of our program, I think it's just so comprehensive and well-rounded because it brings together 3 amazing institutions that have distinct strengths, but also come together to create a residency experience where you see everything and are taught everything. When I was looking at programs, I remember being told to ask all these questions of a standalone children's hospital versus a hospital within a hospital. Is it a fellow heavy program versus a fellow light program? A bread and butter heavy program versus having a lot of zebra patients? What I think is so remarkable about the BCRP though is that I never had to choose or compromise on any of sort of these false dichotomies, because we get to experience both sides of these spectrums through the melding of institutions that we have in our program. Our residency really is this kind of beautiful juxtaposition of going from a quaternary research center that has its own clinical team for Kawasaki disease specifically to New England's largest safety net hospital that is leading the way in how we treat neonatal abstinence syndrome and innovating ways to address social determinants of health in the pediatric space, like embedding free tax services in our outpatient primary care clinics. All that to say is I think how the program has really shaped my decisions going forward is that it's taught me you don't have to give up an emphasis on research, complex medicine, cutting edge advances for an emphasis on social justice oriented, equitable, culturally competent care and vice versa. And in fact, I would argue that it's the responsibility and privilege of every pediatrician to engage in both of these spaces. And that's one of the many gifts that I think that this place has given me on top of so many resources, opportunities, and mentors. In terms of my own specific career path, I'm planning on pursuing pediatric oncology with a clinical research focus on outcome disparities in survivorship care. And I think a lot of that has been engaging in these spaces through all of our institutions and having mentors in general pediatrics, in healthcare research, healthcare services research and disparity outcomes in the oncology sphere. And I think having all those things together has been a really beautiful part of my training here. I really have loved it here, and just like Ty, I would make the same decision again 1,000 times over.
Wonderful. Thank you. And I just want to go quickly, just recognizing that we're towards the end of our allotted time. And just very quickly, and I'll start with you, Christine, and then I'll go back to you, Daniel, and we'll try and squeeze in our other two panelists if possible. But thinking about this application cycle, thinking about where we're at with COVID and virtual interviews and getting to know a city that you may not have ever visited and applying to a residency program, what advice do you have for applicants? What do you think that applicants should be thinking about? What should they be doing now? What pearl would you like them to leave with as we finish up this webinar? Christine?
I think that you are most successful in the match when you portray yourself as you are. And I think that I'm like echoing a lot of people who have already said similar things. But I think pediatrics especially is it's a specialty that really values like the individual and what brought you to the specialty as an individual. And so if you are able to portray that in your application and also, you know, whatever interviews look like, I think that you'll be very successful. And I also think that you have to be really true to yourself and what you're looking for in a program, because I think the match sort of like helps not only put you in a place that like values you as you are, but you also will end up at a place where your values very much align with the program. So I think that it's really important just to be very thoughtful as you're interviewing, and really come away with each interview with your own personal feelings about how you not only, you know, vibed with the program directors, but also how you vibed with the residents, because like everybody said before, like this will be your family for the next 3 years or more, depending on if you want to stay at that institution after graduating. And so you really just have to like think hard about your values as an individual, but also as a clinician. So.
Thank you. Daniel?
Yeah, I think I would actually just double down on that. It's funny because I think the immediate thing that came to my mind was the importance of being authentic, and both in terms of, you know, thinking about how you're portraying yourself in your application, but then ensuring that you've done the self-reflection that that portrayal is in fact who you feel to be your most authentic, vulnerable, and truest self. Because as people have alluded to, as I'm sure you all know, residency is a challenging 3 years, and you want to be in a place that you feel comfortable being yourself, that you feel supported, and that you can bring all of who you are. And I just echo everything Christine said, that pediatrics is an amazing place where we care about people's stories and where you come from. And I think that's part of what makes the specialty so special, and you know, that connection with families, because we want to bring all of that into our interactions with children and their families. So and all of that to say, to just take a deep breath and to relax, because you've already made one of the best decisions, which is that you're going to apply into the specialty.
You know, I'm going to let that comment slide. I'm not going to come back to that one. Maybe I'll go to Nanye and Ty. Dunya, do you have anything else you would like to add other than how awesome pediatrics is as a specialty?
That. So, just, I would say eliminate the word can't from your vocabulary, particularly during this application cycle. Don't, you know, when you think that you may not be equipped enough or prepared enough or, you know, unique enough to get into the program of your dreams, that is the one thing that is going to stop you from matching into the program that you feel you would fit into. I feel like for me, I came from Philly, you know, I'm not from the Boston area. I, you know, obviously am not like typical Boston look. I'm a dark-skinned Black woman, you know what I mean? So at the end of the day, I never, you know, a part of me also thought, you know, this may not be something that I would be able to achieve. And if I had told myself that I can't, or I didn't have what I needed to get here, then I wouldn't be here. And I really think that the programs that you do interview at will see you for who you are, and they will value who you are. So wherever you match, just know that the program is valuing you for who you are. And just to plug our program director is really, really good at seeing the individual and knowing who you are as a person and what you can bring to the whole community here. So.
Love it. And Tyler, I'll give you the
I agree
last
with
word.
everything. Like, just amazing. I completely agree. You guys made the right decision picking pediatrics. I think trusting in yourself and your capabilities is so important. I think I, you know, am fairer skinned, but also had the complex of like, do I belong in this Harvard system? And was honestly told by my director in medical school not to apply to the BCRP because of screening, and now they're a chief resident, so I think a lot about sending an email to them, letting them know that. But I think it just goes to show that you have to trust in yourself and where you can be and what you're capable of doing. And I think we have a whole panel of people who have demonstrated that taking ownership over that and living out that dream is possible, and that we have a whole panel of leaders at both institutions who are committed to seeing and recognizing you as an individual and what you can bring.
Wonderful, thank you. And I just want to say very quickly, thank you to the panelists, Dr. Zhang, Dr. Rainier, Dr. Martin, Dr. Ocholanu. I appreciate you joining us. I appreciate you sharing your insights and your experiences as trainees here. Very quickly, I want to put up a poll, quick survey that we have about the webinar that we just hosted. And I also want to make sure that you all know about some resources that we have available. Lots of our contact information, our information about our residency showcase, which we'll be doing in September, information about that's coming from the AAMC. We're trying to collate this information for you to have it as a one-stop resource. If you have questions or comments or concerns, please reach out to us through our both website and through our email account. If you have questions specifically for the residency programs, you can reach out to them. They're both on Instagram, which is really cool. They've posted their websites and their contact information. Please reach out to them for direct communication. Farah, do you mind putting up the quick survey that we have? We have a short 4-question survey that we'd love for you to answer. It really helps us to cultivate future programs that we're going to be doing. For those of you who have colleagues who are interested in careers in psychiatry, we have a number of psychiatric residency programs affiliated with Harvard Medical School, and we're going to be hosting a very similar webinar for our psychiatric residency programs at the end of July. As I previously mentioned, September 12th is going to be our virtual residency showcase. It's something we've done in person for the past 6 years. Unfortunately, because of COVID, we won't be able to host you all on campus for this upcoming virtual for the residency showcase, but we are going to convert it to virtual. So please be sure to look for more information on that. We also have a couple other programs that we're going to be doing, both related to COVID and also related to the application process. On Monday, July 13th, we are hosting a webinar on the impact of COVID on Latinx communities, and we'd love for you to join us for that conversation and hear from some wonderful leaders who we've brought together in the form of a panel discussion. With that, I will end now. Thank you all for joining us, and I wish you all a good rest of your day. And again, thank you to Fari, to Pinar, to Dr. Reed, and to all of our panelists who joined.